be weaned off in few hours. If you have the similar molecules, and definitely it could be addition to the available antiplatelet therapy, and that is the Cangrelor. And we have the two presenters, I think the Dr. Javeed is going to talk about the Cangrelor, and then the experiences will be talked by Dr. Manoj. And we have our panelists, Dr. Vivek Gupta, Dr. Neeraj Kumar, and Dr. Vivek Mahajan. And I think you can start.
No, Jabir, I'll just take another 30 seconds to introduce further. You know, this is a very important salt, and we know that when angioplasty was done for the first time, and when the stent came up in 1987, done by Sigurd and Jack Kroll together, the major problem at that time was not restenosis but the stent thrombosis. And the trial which confirmed the efficacy of first time antiplatelet therapy other than aspirin was must trial. I want to go into historically, and that was done by Marie-Claude Maurice of France, and that was ticlopidine, which was introduced as one of the very important stent thrombosis, prevention of stent thrombosis. Of course, later it was replaced by clopidogrel and now ticagrelor, and now what we're talking is now intravenous form of this. So what we are actually talking about is a best treatment to prevent stent thrombosis. Stent thrombosis still is happening, even especially in complex angioplasty. Although the percentage has come down drastically to 0.2% overall, but we have to find a solution to make it zero. And this is a small intravenous form of antiplatelet therapy which Dr. Jabir is going to talk about. Rest of all them they are all oral, or they are of course platelet inhibitors. But can we bring down stent thrombosis to zero or not? That is the question. And I think the future will tell. It is not Cangrelor, something else will happen. So I wanted to introduce this thought just because stent thrombosis can kill the patient. And therefore you have to be very, very sure not to have it. A best antiplatelet therapy other than oral can be this Cangrelor.
Thank you. So this is a guy who was diagnosed with